Good morning to everyone. Today, with pleasure to invite Dr. Kavita Molpiche with the brief talk of OSCE related to the topic OSCE that is coming in essence of. Dr. Kavita Molpiche completed PhD in nursing in the year MSc completed in the year of 2007 in clinical and obstetric nursing. MSc in psychology from Madras University 2013 and completed postgraduate diploma in counseling psychotherapy from Kannur University in the year 2014. Madam is working as a principal of State Institute of Medical Education and Technology, Kerala, having 18 years of teaching experience in nursing. Worked as a visiting professor of St. John Fisher College of Nursing, New York for 4 years. And Madam also got honored by Sigma Theta Tau International Honor University for the contribution to nursing education. Having more than 15 publications and many are in the Scopus Index journals. Received the Best Scientific Paper Presentation Award in International Conference conducted at Tirthankar Mahadevar University, UP. Presented many papers in national and international conferences. Thank you, Madam, for accepting our invitation to talk in Parul University of Nursing. We are inviting you to talk in our session. Thank you, Madam.
Am I audible to you?
Yes, Madam.
Okay. I would like to thank the Parul University and the organizing committee members for giving me an opportunity to interact with you all. I hope we will have a fruitful session today. And our today's topic is the essence of OSCE. I hope you are able to see my slides.
Yes, ma'am.
In this, I will be dealing about I will be giving an overview of OSCE, and I will be just telling you how to plan and OSCE and how to evaluate the OSCE. What is OSCE? OSCE is objective structured clinical examination. So, using for objective structured clinical examination. This is objective because standardized scoring tools are used to assess the student's skill as well as knowledge. And it is structured because same level of difficulty all students will be through. So our evaluation will be uniform. And it is clinical because it is clinical oriented and we are giving real life clinical situations for the students for the examination. And of course, it's an example because by using it, we will get reliable assessment of students' performance and students' competence. We'll be able to assess by using this. So we can tell that it's an assessment also. Now, I'm going to give you the definition of OSCE. Here I'm giving a short but comprehensive definition of OSCE. OSCE is an assessment of well-defined clinical skills. It is given by Ward and Willis in the year 2006. It is an assessment of well-defined clinical skills. Now we are moving to the advantages of OSCE. See, we know that in our traditional practical examination, we used to conduct it at the hospital setting, and there the students will be getting a single patient, and that means they are getting only one scenario. But here we are getting, we are having different stations, and the students will be getting different scenarios. So, but at the same time, uniform scenario will be there. That doesn't mean that all the students are getting the same scenario. The difficulty level of the scenarios will be same for all the students. But in a normal practical examination, we cannot expect the same. Sometimes one student may get a patient with fever and another student may get a patient with all the complications. So the difficulty level may be different. But here we can make sure that the difficulty level will be same for all the students. That is the first advantage. And next one is large samples of students' clinical abilities can be assessed. That is, even if we got 100 students in a batch also, we can assess them. Only the thing, proper planning is needed. So that is one advantage. And another one, examiner can specify in advance what has to be assessed. Actually, this advantage is mainly for the students. That is, examiner is need to specify what they are going to ask. So the students will be getting an idea what are the questions they are getting. All of a sudden, the examiner cannot ask questions from all the subjects. What is happening in our normal examinations, we know that the examiner will be asking questions from here and there and from all the subjects, all the topics you can expect the questions. But here it's not like that. The questions should be planned already and the scenarios also should be planned already and it should be written over there. So the examiner is not having the chance to show his performance over there. And next one is safety or no danger of injury to the patient. We know that when we are conducting traditional practical examination, we used to assign a patient to the student, and most probably because of the fear, tension, and anxiety, the students may perform some of the things in which they are not supposed to do. And sometimes they may not do certain things which they are supposed to do. And that may become dangerous for the patient. So, but here we can give the simulators and we can make the patient to make the students to do the procedures or skills, whatever it is for the simulators. Otherwise, you can use the simulated patients also, but we can ensure the safety of the patient. That's the main advantage of OSCE. And another one, feedback from actors and simulators. Sometimes you may think that when you're doing OSCE, is it possible to get the feedback? Yes, of course, we can. Because in the normal practical examination, we can collect feedback from the patient. So you may be satisfied with that. Here also it's possible. If you are using actors, that is if you are using simulated patients, you can have the feedback from the simulated patients. And if you are using simulators, you can modify the simulator in such a way that it is capable of giving the feedback for the student. And next one, it allows the record. That is, if you are recording the OSCE stations, if you're taking a video recording, later after the OSCE examination, the student can go through this video recording and they can see whatever they have done. And if they have done some mistake, they can go through that mistake again and they can rectify it. So it helps for the students for rectifying their mistakes. But in the normal situation, we know that recall is not possible actually. And situations can be tailored to level of skills to be assessed. That is, we can tailor the situation to different levels so that it can be used for an examination or can be used as a licensing examination or as a competitive examination or can be used for different levels of students also. And it allows the teaching audit. Of course, if you are using it effectively, we can audit the teaching and learning process by using the OSCE. That is, we can evaluate the effectiveness of teaching also by using the OSCE. And the next one, it allows demonstration of emergency skills. For example, in your traditional examination, if an examiner wants a student to perform the intubation, sometimes we may not get a patient for that. And sometimes even if you are getting the patient also, because of the tension, sometimes the student may do mistake and it may become harmful for the patient. So in that case, it won't be possible for you to see the procedure exactly. But here we can set a station for that intubation and we can make the student to do it. So that's the main advantage. We can have emergency station skills also. Or we can have stations for the emergency skills also. And another one, it maintains variety and because of that, it stimulates the interest of the student. In our traditional examination, we are giving one patient and the student has to be with that patient throughout the day or throughout the time of examination and there is no change. But here the student will be getting different type of stations, different type of scenarios and they'll be moving from station to station. So that will stimulate the interest of the students also. And another one, it increases the faculty-student interaction. Already I have told you that station will be there and in each station skill also will be there. And for each skill, when the students are performing it, an observer or an examiner should be there. So full time the examiner will be with the student only. So when you are being with the student full time, of course, the chance for interaction is also more. And another one, OSCE is adaptable to local needs. Sometimes when you're thinking about the OSCE, you may think that it is possible only in a well set up simulation lab. It's not possible in the local situations. It's not like that. We can do it in our own area with the available things and we can modify the things and we can do. So it is possible even in the local setting also. And another one, broad sample of knowledge and skill. See, in the normal practical examination, we are assessing any one skill. That is, we will just see whether the student is able to perform that particular, only one procedure we will be observing mostly. And sometimes we may see the communication skill of the student. That's all, that's a maximum. But here the advantage is we can see different types of skills, different stations we can have, and we can see the different types of skills. We can see the attitude of the student, we can see the knowledge of the student, we can see the competency of the student. All these things can be assessed by setting different stations. So that's a main advantage actually. Then input from multiple evaluators. See, in case if you're having more different stations, we know that an observer should be there for the station. So naturally more than one evaluator will be there. And after the evaluation, naturally all these evaluators will be giving feedback for the students. So the students will be getting feedback or input from different evaluators. And another advantage, rapid scoring and decision making. See, in our normal theory examination and all, after the examination, we have to wait long for the publication of result, correction of papers, all those things. But here it's not like that. Immediately after the station, see, if a particular student is performing a task in a particular station, immediately after that, the observer should do the scoring. Or they should make the marks, whatever it is, award the marks, whatever it is, whether they are observing the competency, whether they are putting mark, whatever it is, they have to do immediately. Because otherwise, within a short time, within 1 minute, the other student will come to the same station. So before the arrival of the next student, actually the examiner is supposed to complete the scoring process. So it's a rapid scoring and decision making process. Within seconds, you will come to know whether the student has passed or failed. Okay, these are the advantages of OSCE. Now we are going to see the limitations. See here, I am not using the word disadvantage because OSCE does not have any disadvantage. Why I am discussing the limitations over here means by anticipating these limitations, we can plan in advance and we can avoid these limitations. In the limitations, the first one is training. Yes, of course, training is needed for the faculty, training is needed for the students, and training is needed for the patients in case if you are using simulated patient. For setting the stations, for evaluating the OSCE, and for arranging the articles, for everything, we need to train your faculty. And we need to have this training for the students also. We need to, if possible, we can give even a mock test before the original examination. We can make the students to go through the stations and they can have a model examination before the original examination, so that students also will be relaxed. And another limitation is risk of observer or examiner fatigue. Sometimes in a day, 2-3 batches of students will be there, and the whole time the examiner has to be with the station or they have to be with the student. So now automatically the examiner will get exhausted and they will become tired. So here, for overcoming this limitation, what you can do means you can plan break section in between the stations. So that limitation also we can avoid or we can overcome. And another one is organizing stations with equal time. If we are able to give equal time to all stations, it is ideal. All students in a group can finish exam at a time. In case if you are giving different time, it's okay, but you have to plan break in between. Otherwise, you won't be able to complete all the students at a time. And another one, textbook scenario may not mimic the real scenario. See, for the skill stations or for the stations of OSCE, if you are taking a scenario exactly from the textbook, it may not be exactly like the real clinical situation. We know that actually. So what the examiner can do in that case means the examiner can use her experience or expertise from her own experience, what she observed in the clinical area. On the basis of that, she can make a scenario so that it will match with the exact clinical scenario. Instead of taking from the textbook, they should do that. And next one, there is a common comment that OSCE is expensive. Yes, of course it's expensive, but it's only in the initial stage. Initial cost of purchasing simulators will be there. But later it will be same as like other examinations. The cost of the expense will be almost same as like other examination. Only in the initial period, the expense will be little high. And of course, we need more manpower when compared with the traditional practical examination. But at the same time, that is an advantage also. You are getting an opportunity to equip your lab with sufficient materials, sufficient mannequins, and at the same time, you can equip your institution with sufficient manpower. So you can take it as a positive side also. Next, we can see the feature of the OSCE or features of OSCE. This skill to be tested is given in the form of task, and it has to be answered in 5 to 7 minutes. Here I told that it is 5 to 7 minutes. This is a common timing actually. It is not compulsory that the time should be given. Time should be 5 to 7. You can have timings according to the type of stations or type of skill you have set over there. According to the task, you are supposed to give the time. Commonly, you can have 5 to 7. And each task is a station. You should not put so many tasks in the same station. If we are keeping one skill at a station, that is better. Otherwise, the students will get confused. If you want to have one more skill, you can have one more station. You can have another station. And for each task, a checklist is prepared in advance. For each station, already I told you that in each station, only one task should be there. And for each task, you need to have a checklist. If you are using a skill, you need to have a checklist. Or if you are using an attitude, if you are assessing the attitude of a student, you can have a rating scale. It depends on the station, type of station. Anyway, you need to have something to evaluate the student's performance, and that should be prepared in advance. If it is a checklist, you have to see what is there in that station, and on the basis of that, you have to prepare a checklist, and it should be available already. And the scoring is objective in the case of OSCE. We can use simulators and mannequins. That is the main attractive feature of OSCE, because even if you don't have the patients also, we can use the simulators and mannequins for conducting the examination. Next, we can see the components of OSCE. The first one is an examination coordinator. In order to make sure the smooth conduct of OSCE, a coordinator should be there. In our colleges, we are having department, and each department is working as a team for OSCE, and usually the department head will be the coordinator, and that person will see the overall conduct of OSCE. The same thing the others also can do. And the next is list of skills, behavior and attitude to be assessed. This will have to see, you need to have a list of skills. Already I told you that you can have different stations. So already you should have an idea what should be there in each station. So how many skills you are going to keep, how many stations you are having, all those ideas you need to have. And we need to have a blueprint for the OSCE and list of equipments required for the station. That also should be available, or that also you should prepare in advance, and a scoring scheme also you are supposed to prepare in advance. So these are the main components of OSCE. And another one, examination site or station. So this has to be planned in advance, where it has to be conducted, whether all the equipments are arranged or not, how many stations are needed for that particular examination. All these things should be done before the all these things should be done for the setting of the station. And of course, we need to have an examinee or a student. So that is the important part actually. And about the patient, we can have the real patient, or we can have the simulated patient, or you can have the simulators or mannequins, whatever it is. It depends on you. And of course, a timekeeper also should be there. And that person can see the timings, and they can give information to the students to change the stations after the fixed time. So they'll be giving information to change after the fixed time. And the next component is a student rotation. This should be planned in advance. When you are doing this rotation, we should see the number of students, time duration of examination, and number of evaluators available for assessing the students. And on the basis of this, we have to make the rotation of the students. Here you can see an example of rotation. Here date I have specified, timing for each batch of students is also specified, and how many students are coming between that time, that is also specified over here. You can go through this rotation so that it will be very clear for the students when they are supposed to come, and for how much time their examination will be there. All those things will be very clear for the students. Now we can see the tips to develop OSCE. Decide on the intended use of the result. That is, whether you are using OSCE as a formative assessment or as a summative assessment. Decide that first. And second thing, decide what the OSCE should assess. Whether I want to assess the knowledge of my student or attitude of my student or skill of my student. That you should decide first. Looking at the learning outcomes, see how you are supposed to make the OSCE and make a blueprint of the OSCE on the basis of these learning outcomes. So here is an example of a blueprint of OSCE. So in that first is the topic or content area. You have to plan the topic on the basis of on the main areas by considering the main areas in the curriculum. See this example here, I have given the topic as infection control. Then I have to decide the form of assessment, whether I have to give a procedural skill station or a history taking session or an examination session. Like this, I have to spell out what exactly is expected out of the student. So when you are looking at the blueprint, you will get an idea how many questions can be asked and how many procedural skill stations are there and how many patient teaching sessions are there. All these ideas you will be getting from this OSCE blueprint. And even you will come to know total number of questions. All these details will be there in the OSCE blueprint. Next about the OSCE station. I'm using this word station from the beginning onwards and you may think that what is that? A station is the site at which the student is assessed on a particular ability. And when you're preparing the blueprint, you will get an idea that how many stations you need to have and consider each task as a station. Don't confuse the students by giving so many tasks in a station. The number of stations depend on the skill you want to assess. But always it is better to have more than 5 stations so that you can make sure that the students are competent in that particular content area. And before setting the station, first identify the venue for setting the station. And make sure that that place or that venue is having space to arrange the number of stations as per your blueprint. Next, we can see the instructions for the station setup. First, we should make a list of equipments required for the station. See the blueprint and identify what is there in each station and make arrangements accordingly. For example, if it is a procedural section or procedural skill station or if it's a skill station, arrange all the articles needed for that procedure. During the time of OSCE, in between, you should not run here and therefore by searching the articles. And instructions for performing the task should be there at each station. That is, if you are expecting the student to check the Hammond sign, that should be written over there. So it is better to have numbers for the station and it is better always you should write and keep over the station what is expected out of the student, or the instructions for the students also should be there at the station. And next, you should make sure that adequate number of chair, cot, table, all these things are available in each station. And we should make sure the presence of patient, subject or models, whatever you are using. And examiner also should be available. And time frame, already we have seen that also should be there. Next, we can see the type of stations. Already we have seen the blueprint, so we know that different stations are there. The first one is history taking station. If you have given a scenario to the patient, the student should collect the relevant history. For example, if you have given an antenatal mother to the patient, if you have given an antenatal mother to the student should collect the antenatal history. They should not go and collect the other history. They should collect the antenatal history. And the second station is examination station. Here we can have various assessments. That is our neurological assessment, cardiac assessment, reproductive assessment, all those things we can do over here. But here we should not tell the student to do the complete assessments. For example, if I am giving an antenatal mother, you should not tell the student to do the complete antenatal examination. Instead, we can tell the student to do only abdominal palpation. So otherwise, it will be very broad and widened and the students may not be able to complete it within the set time. And the third one is skill station. Many of your procedures we can plan over here in the skill station. And the fourth one is communication station. Here we can tell the student to teach the patient. or communicate to the patient. For example, if I have given an antenatal mother, here you can tell the student to teach about the antenatal diet. And the fifth one is response station. In the response station, you can give a question to the student and the student can tell the answer or the student can write the answer. It depends. For example, the previous session was antenatal mother only. So here you can tell the patient student to write the minor disorders of pregnancy. So either the student should spell out the answer or the student should write the answer. And the next one is rest station. Here in the rest station, actually the students will get some kind of rest in between. So that also should be there along with the other stations. And next one is interpretation of investigations. For example, already we were discussing about the antenatal mother. So you can keep an NST recording over there. That is non-stress test graph you can keep over there and you can tell the student to interpret the findings. And another one is patient education station. Even if communication skill station is there also, we can have an additional skill for the patient education station. That is better. And next is basic and advanced clinical skills. We can plan basic and advanced skills station. For example, if you are doing the examination for a UG student, you can plan for the basic stations. And if it is for a PG student, you can plan advanced skill stations. It's up to you. And it's up to the level of the student also. And in the previous example, you have seen that everywhere I have used the antenatal mother. For the history taking, I have given an antenatal mother. For the examination, I have given an antenatal mother. For the education session, I have given an antenatal mother. And for the interpretation also, I have used the NST recording. So if there is a link between the station, all the stations are linked. So if that type of link is there, means that station is known as a linked station or a couplet station. But it's not compulsory that always you need to have the link of the station. If it is there, the students will get a continuity. And you can make sure that the student is an expert in that particular area. Here, after completing all the stations, I can make sure that my student is an expert in antenatal area. So that you can do. But you can have totally different stations also. That is not an issue. Next, develop the cases or questions. When you are developing the questions or cases, you should not take exactly from the textbook that we have seen already. It should be a real representation of the clinical problem. And after preparing the scenario or after preparing the question, you should validate it. Sometimes it may not be possible for you to validate the scenarios all the time. In that case, or sometimes it may be difficult for you. In that case, what you can do means you can just give it to the concerned department and you can tell them to, or you can request them to go through the questions and so that you can make sure that it is adequate. In case if you are not able to do the validation, but if you are able to validate the scenarios or questions, it's well and good. Next one is instructions for the students. That also should be there in the scenario stations. So the students will get an idea what is supposed to do and how much time they will get. All this idea the students will get. And of course, the time limit also should be specified over there. And next one is focus on core competency. You cannot mix many cases in a case scenario. If you want the student to plan a care, give all the details related to that. Keep only the needed things. For example, if you are telling the student to list down the interventions, in that case, you should give complete signs and symptoms to the student. A list of signs and symptoms should be there in the case scenario. Next one is checklist or rating scale or scoring scheme. If you want to assess the skill, you can have a checklist, or if you want to assess the attitude, you can have a rating scale, or if it is a question and if the student is telling answer to you, you can have a scoring scheme. And already you have to decide how you are going to assess the student. Only the thing, whether you are using checklist or rating scale or scoring scheme, whatever it is, that doesn't matter. Only the thing, you should decide it already. And if it is a checklist, it should be prepared. Whatever it is, you have to be ready with that. That's all. Next, orientation to the examiners or evaluators. sometimes the internal may be oriented to the situation because most probably she may be the person who is setting everything, he or she. But the external may be an outside person, and that person may not be oriented to the situation or may not be oriented to the place, everything. So in that case, it is your responsibility to orient the external examiner also. So the instructions for the examiners also should be there. In that, very clearly you should specify that they are not supposed to interrupt the students when they are performing the skill. In case if they are having some remarks or comments, they can write it in their evaluation sheet itself. There will be a separate, or there should be a separate space for the remark section. And indicate the awarded marks by ticking. So if it is like that, if your checklist is like that, you can put a tick mark, or if you're supposed to enter the mark, you should do that. So that instruction also should be there in the examiner instruction sheet. And if they are having comments or observation, they have to write that and assign the marks before the arrival of the next student to the station. For each and every student, they should assign the mark. And finally, after making the complete score, or after putting the complete score, they should write their name and nature also should be there in the scoring sheet. And next one is develop scripts for the training of standardized patients. Already I have told you that you can use actors or you can use the standardized patients. In that case, you should teach them what are the expected questions. Naturally, a certain pattern of questions the student will ask, so you should teach the answers of those questions. So prepare for the anticipated questions, and in case if the student is asking unexpected questions, you can tell them they very well they can give the answer. I'm not sure about that. So in that way, the standardized patient or the actor also should be confident to face the examiner or face the examination. That much training should be given to the standardized patients if you are using standardized patient. Otherwise, you can use the simulators. Next, ensure the integrity of the data collection process. That is, we know that we'll be having an evaluator in each station, and for some stations we may not be having an evaluator. Some stations we can keep like that also. For example, if it is a question answer station and if the student is writing the answer, later also you can evaluate. In that case, even if the examiner is not there also, it's not an issue. So that type of stations without examiner is not known as unmanned station. And all the other stations will be having an examiner, and the examiner should complete the scoring key immediately after the completion of particular student's particular station, so that it will be easy for you to enter the complete data finally. Otherwise, if something is missing when you are entering the marks into your system, or when you are entering the marks into your register, it will be difficult for you. So then and there, we should enter it. And choose a standard setting approach. Decide a cutoff for the pass, a percentage that should be decided, and that should be common for everyone. Next, compare the score of OSCE. That is, after taking the evaluation by OSCE, you should see or you should compare the performance of the student with other methods. Other methods in the sense, sometimes you may be having a clear picture about the student's performance in the clinical area, and sometimes your student may be better in the class or in the theory session. So always it is better to compare the performance of the student in other areas, so that we can make sure that whether the OSCE was effective or not. And the next one is evaluate the effect of OSCE on learners. Always after conduct of the OSCE, you have to take feedback from the students, or you have to evaluate the effectiveness of OSCE. For that, you can have a survey or you can have a focus group discussion. Whatever it is, it's up to you. You can have it with the students and you can get the feedback or evaluation from the students, because it is needed for the success of OSCE. In case if any pitfalls or any difficulties are there, means if you are collecting it or if you are getting the exact evaluation, next time you will be able to rectify it. And next one is review the entire process. After the evaluation or after completing the OSCE, all the examiners, they should sit together and they should discuss so that they can modify the next performance or next OSCE. So they should discuss whether the time was adequate or not, whether they faced any difficulty during the process. So those things should be discussed over there and it should be rectified before the next OSCE. So these are the important tips for the OSCE. Next, we can see what are the things we are supposed to do before the OSCE. Discuss the number of OSCE sessions and time limit. This already we have seen, but again, once again, I will tell because it's very important. So the students, and this all should be explained to the students also. Already we are planning, you are preparing a blueprint, everything is there with you. And if you are keeping it with you means the student will be totally blind. So what you are supposed to do means you are supposed to discuss it with the students so that the students, when they are coming for the examination, they can face the examination without stress, fear or tension. Discuss how many stations are there and how much time they will get in each station, and tell them that a bill will be there after each session. After this set time, there will be a bell. So the timekeeper will be giving an information, that is the bell. And after that, again, they will get one more time, 1 minute for changing to the next session. All these things should be explained to the students. And further, if any doubt is there for the students, that should be clarified, and the station movements also should be explained to the students in case if you are having a second group. Sometimes on the same day you may be having 2-3 groups. So after the completion of the first group, coming for the Viva, coming for the OSCE. In that case, we should make sure that these 2 groups are not meeting together, because we are using the same stations for the first group and second group. And if these 2 groups are meeting together, they will discuss and the second group will score more when comparing the first group. So for avoiding that, what you can do means you can give a particular time for the second group students, and you can have a waiting area, and you can make the second group students to come and wait in the waiting area, and a teacher can be there. And when the first group students are completing the OSCE, you can send them out of the hall through another way, so that we can avoid the meeting of these 2 groups together, so that your evaluation will be perfect. And during the process of OSCE, observe and assess the performance of the student. That is a duty or responsibility of the teacher or observer or evaluator. And the examiner should be there with the student, but at the same time, the examiner is not supposed to interfere with the student, because even if they are doing something, some mistake also, it's not a problem because they are not going to harm the patient. Everything is in a simulated setup. So they have to be there without interfering the student. And if remarks or something is there, means of course they can write over there. Marking schedule should be completed while the candidate is in the station. That is already I have told you, before the arrival of the next student, the marking or scoring of the particular student for that particular station should be completed. And in case one student is completing one station or the task which is given to him, if he is completing before the set time, he should wait in that station till the time lapse. And the candidates always tell to the candidate that they should speak out or they should communicate when they are performing the task. Sometimes they may think that here real patients are not there, only simulators are not there, so it is only simulators are there, so it is not needed to communicate. But it's not like that. They have to communicate, and it will be observed by the observer or examiner. And in case the student is not able to complete the task on the specified time, after the specified time, by leaving that task, the student is supposed to move to the next station, because sufficient time you have planned and you have given over there. And if the student is not able to complete within that sufficient time, it is a mistake of that student. Sometimes it may be due to lack of competency or maybe due to some other issue. So it is compulsory that after the set time, the student should move to the next station. And after the process, a student can discuss what she did, whether she did well or not, or whether whether she wants to improve or not. All these things should be discussed with the student. So always remember, when you are giving the feedback, we are supposed to give feedback to the students. When you are giving the feedback, we should not start with the negative. always start with positive feedback. You can tell like this: okay, you are these areas, this skill station you have done perfectly. Your competency was good in that particular area. You have communicated well, but for this particular station, you were lacking or you were missing these competencies. You have to improve. So next time you will be able to do it better. So in that way, you should give a feedback to the student. And all the teachers, whoever is involved in the OSCE, they should give feedback to the student. And after that, they should decide whether the student is competent or whether the student needs additional practice or not. So that is the thing we are supposed to do after the OSCE. And these are the important points you should consider when you are evaluating the OSCE. That is the purpose, the group, and the weightage. First, you should see the purpose. That is, you should see whether it is a learning tool or an evaluation tool. In a learning tool, if it is as part of learning process, even if the students are making mistakes or errors also, we can make the students to repeat it. They will get a chance to repeat it. And in that case, it is not compulsory to give the score in case if they are making mistakes. And you should see whether it is a formative assessment or summative assessment. And actually, if it is a summative assessment, immediately we are supposed to give the marks and the students will not get a chance to improve because it's a final examination or final evaluation. But if it is a formative, we can do it along with the posting, or you can do it along with our theory session. And again, if the student is not competent, we can make the student to repeat. So first you should see the purpose of OSCE, and on the basis of that only we are deciding whether we are supposed to give the grades or mark, whatever it is. Next is the group. You should see whether the group is a PG group or UG group. If the students are a PG group, you will be expecting advanced skills. And if the student is performing only the basic skills, in that case, you cannot give much score or you cannot give more marks to the student. And the scenario also should be according to the level of the students. And we should see whether it is a licensing examination or an induction program or an entrance examination, or you should see whether it is a final year student or a first year student. In all these things, the evaluation also will be different, because if it is an induction program, it's a continuous process. Sometimes it may last for 1 month or 2 months. It depends on the institution. And finally, you may be getting the final evaluation. All these things you will be counting together. And if it is a licensing examination, and if you are using OSCE for the licensing examination, then and there you have to give the score and you have to set a cutoff, and it should be published immediately. So the scoring or evaluation depends on the group or type of examination. Next, about the weightage. I told you it can be a summative or formative assessment. We should see how much marks should be given. Sometimes it may be an additional examination along with your clinical examination. In that case, we should plan how much should be given for the clinical and how much should be given for the OSCE part. For example, sometimes for the obstetrics and gynecological examination, since I am from that's my subject, I'm using it repeatedly. Sometimes you may be having a practical session in the morning in the hospital, and in the afternoon you may be having an OSCE session in your lab. In that case, you should decide how much you should give for the practical in the hospital and how much you should give for the OSCE in the college or in the lab. So this you should plan, and always when you are giving the weightage, give more weightage for the skill stations or for the procedural stations. So if you're planning it that way, it will be better for you to see the competency of the students. And how to score and interpret the checklist. That is clinical points. Already I have told you that the clinical points or procedural skill station, that area we should give more marks or more weightage, and decision of the performance to be based on the performance as well as total score. And these are the certain criteria you can use for evaluation, or you can use for deciding the percentage of marks that can be given from each category. For the history session, it's an only example. You can make the changes according to you. For the history taking session, here I have given 30 to 40%. And for the physical examination section, here I have given 20 to 40%. For the patient education, I can give 0 to 10%. For the nurse-patient interaction, the patient-student interaction, you can give 20 to 40%, and for the recording and reporting patient note, you can give 5%. This is a category. And this is the common category what we are using in our situation, that is assessment, planning, implementation, and evaluation. And in these cases, if total mark is 100, most probably you can give maximum weightage to the implementation section, because there only the students will be performing the maximum skill. So the 40 marks you can give for the implementation, balance 20, 20, 20, like that. You can give assessment 20, planning 20, and evaluation 20. All together it will become 100. You can plan like that also. And another one is Tanner's clinical judgment model. The criteria of that model is the noticing, interpreting, responding, and reflection. If you want, you can use this model also for the as a criteria for the evaluation. And next is grading and interpretation of OSCE. In the grading, you can decide whether the student has passed with the high performance or superior performance, or the student has just passed or failed. Or you can tell only pass and fail. Or sometimes you may be mentioning competent or not competent. Sometimes you may be mentioning only the pass. And otherwise, it may be like this: potential fail, partial fail, and full fail. Potential fail means the entire station. The student might have done total mistake in one station. That entire station actually the student has to repeat if it is a formative assessment, and the student might have failed only in that station. Partial fail means the student failed in partial aspect of one station. Partially he did it well, and partially he made some mistake. And full fail means in all the stations the student failed very badly. And another one is you can give marks, or you can decide the percentage also. It's up to you. These are the different ways I have just given as an example, that's all. Next, feedback. Always it is important. Feedback of the performance is given at the end of the whole group, or it should be given to each student, or you can give it group wise also. Any marks you should give individually. And if the competencies are not 100%, you can give opportunity for the students to revise it if it is a formative assessment, if it is possible. And at the end of this session, I want to tell you that OSCE is a good method of assessment, but not a replacement of clinical examination. But for the time being, especially now when we are in the middle of this pandemic COVID-19, we can use it. Of course, you can use it along with your clinical examination, so that we can make sure that your students are more competent and they are experts in the field. When used correctly, OSCE can be highly successful as an instrument to assess the competence. And it's told by Ronald Harden. And thank you for your patient listening.
Thank you, madam. And some questions we have to ask from our students and some faculties. So the question is, first one, it is how OSCE is effective in current situation.
Already, I think I have given an answer, because now we are moving through the pandemic of COVID-19. So we may not be able to conduct our examinations or regular examination, whatever scheduled in the hospital settings. So in that case, we cannot delay the students also. They are supposed to complete their examinations and course within the time limit. So in that case, for the student's sake, you can have it the OSCE, and it will give a clear picture about the student's performance also.
Ma'am, another question, it is why OSCE practice is less in India compared to European countries. While we are attending any kind of European country examinations, it's compulsory to attend OSCE. But we are seeing whenever we are going any interview in college or hospital, we are not facing any kind of OSCE examinations.
Really, it's a bad thing. And I have mentioned it actually. We are believing that we need to have a well set up simulation lab for the conduct of OSCE. But it's not like that. I have already told you that it is adaptable to the local needs. With the existing things, with the available things, you can do it in your own institution also. Because how I'm telling it means I'm doing it in my institution. With the existing things, it's a government setup. With the available things, we are doing it over here. So if we can do it over here, means everywhere in India we can do it. Of course, it will stimulate the interest of the students, and it will increase the competency of the students also.
Then one more question. It is how we can overcome the difficulties to implement OSCE in nursing education systems.
Difficulties means what are the difficulties you are facing? Can you list out all those things?
Yes, some difficulties we are facing, some knowledge related, management related, equipment related. So how we can able to is comparison from India and European countries, because our education system and we are getting inadequate articles or equipments. So how we can able to manage and we can provide more knowledge to students.
One feature of OSCE is it needs training. Actually, we need to give training for the faculty. So the faculty will become confident. Once, if you are confident, only you will be able to give it to the students. So the what you can do means if it is for your setting, what you can do means you can have a training session for your faculties. And very well, after the training session, 1 week training sessions are giving. Even I heard that Manipal is giving one week training session for the faculties all over India. And if you are interested, you can have that session in your college also, so that you will become more confident. So that's the solution for this, I think.
Okay, thank you so much, ma'am, for your valuable speech in the behalf of Parul University and Parul Institute of Nursing. Thank you so much. And ma'am, you can anything to speak to our Parul University and Parul Institute of Nursing students relating to
I'm very happy to see you all over here now, and I would like to thank the Parul University, and the organizing team members for giving me this opportunity to interact with you all. Thank you once again, and I would like to thank the person who is speaking to me, Mrs. Ampli Vijayakumar, and the principal of Parul College of Nursing. Thank you once again. Thank you all.
Thank you so much, ma'am. If any questions and queries relating to the topic, we will mail you, ma'am, and kindly reply in our mail. Hello, ma'am. Are you able to hear me?
Yeah, sure.
Yes, ma'am. If our students or any participants having any kind of queries relating to OSCE or any doubt or any questions, we will mail in your mail ID and kindly mail to us back the replies.
For sure, you can give my mail ID to them. You can share it, and it's my pleasure, of course.
Thank you so much, ma'am.
Thank you.